In a female baby who's in the mother's womb at 5 months of intrauterine life, there are a lot of follicles, around 2 million. At birth, there are only 1 million follicles. So even before she is born, the follicular atresia starts. At puberty, 25,000, and at the time of menopause, there are only 500 follicles left in the ovary. So this is important because even after menopause, sometimes escape ovulation and pregnancy has been documented in literature. Now, 10 to 15 years before the menopausal transition, there is a shortening of follicular phase because there is less estradiol. So, the negative feedback on the pituitary goes. So, consequently, there is more FSH from the pituitary, and then more FSH leads to shortened follicular phase. So, shortened follicular phase leads to decrease in the duration of menstrual cycle. So, as a lady approaches menopause, she starts getting her periods more frequently. So, at the onset of menopause transition, the cycle length begins to increase. 10 to 15 years before menopause, cycle length decreases. But when she is actually nearing menopause, the cycle length begins to increase. Now, there are 3 classical ways in which period might see. It may suddenly stop, or it may be a gradual diminution in the amount of blood loss with each regular period till menstruation stops, or it can be a gradual increase in spacing of the menstrual period and until they stop for a minimum of 1 year. So, this is the basic hypothalamo-pituitary ovarian axis. So, the hypothalamus secretes the gonadotropin releasing hormone which acts upon the anterior pituitary to secrete FSH and LH. FSH acts upon the ovary for formation of graphene follicle and release of estradiol from the granulosa cells of the graphene follicle. LH acts upon the graphene follicle to cause final maturation of oocyte and ovulation and formation of corpus luteum and secretion of progesterone from corpus luteum. So, what happens is, if when the ovarian function is declining, there is decreased estradiol and decreased inhibin B. So, as a result, what happens is the negative inhibition on the hypothalamus goes and the FSH LH is secreted more. In fact, FSH and LH values of more than 40 can be used to diagnose menopause. Now, what happens is there are other sources of androgens in the lady, and these include the adrenal gland. The adrenal gland secrete androstenedione, DHEA, testosterone and dehydroepiandrosterone sulfate. The function of this testosterone is required for erythropoiesis and libido in the lady, and then this androstenedione from the ovary as well as the adrenal gland go to the peripheral fat cells and they get aromatized to form estradiol and estrone. Now, estrone is a main hormone in the postmenopausal period. Now, menstrual cycles nearing the menopause are usually not associated with ovulation. So, they can be anovulatory cycles. So, that means there is not enough progesterone coming from corpus luteum, and so the lady may have irregular periods, anovulatory cycles and heavy bleeding